Good afternoon, everyone. Welcome and thank you for joining our webinar today. My name is Addie, and I'm the Business Development Manager at databrackets. I will be your host for today's event. databrackets has been in the forefront of supporting businesses to comply with HIPAA, HITRUST, SOC 2, ISO 27001, and other compliance certifications for over a decade. In today's webinar, we will shed light on HIPAA compliance and how it applies to telehealth solutions. Our guest speaker, Jeet Chawla, will showcase the challenges faced by telehealth providers and discuss his journey while building Ace Health solutions. We will discover the solutions to managing this EPHI in the pandemic and discuss the options that we anticipate for the future. Next slide, please. There are a couple of basic housekeeping rules to keep in mind first. The webinar today will be approximately 45 minutes long, including a Q&A session at the end. All lines will be muted during the presentation. I encourage you to submit your questions as they come up. You can simply type in your questions in the chat panel on the right side of your screen. For those of you who have already submitted your questions, thank you. We will be addressing them at the end of the prepared presentation. This presentation deck is available in the handout section of the GoToWebinar panel for you to download. We will be emailing you the link to the recorded webinar as well. You can connect with us on social media or via email and phone. Next slide, please. I'd like to begin with our disclaimer. This webinar has been provided for educational and informational purposes only and is not intended and should not be construed to constitute legal advice. Please consult your attorneys in connection with any fact-specific situation under federal law and the applicable state or local laws that may impose additional obligations on you and your company. Next slide, please. I had the privilege of introducing our director, Srini Kolathur. Srini is a results-driven security and compliance professional with over 20 years of experience in supporting, leading, and managing global IT security, compliance, support, and a risk assessment in Fortune 500 companies. Some of his key areas of focus are HIPAA, PCI, Sarbanes-Oxley, ISO 27000 series, NIST cybersecurity framework, CMMC, among others. He is active in several community groups, including Rotary International and TIE. I could go on and on about Srini's experience and achievements, but will not do justice. Therefore, I'll hand it over to him now and ask him to speak about his experience and the services offered at databrackets.
Thank you, Aditi, for the wonderful introduction. Good morning, good evening, from wherever you're joining. My name is Srini Kolathur, as I said, as Aditi said. So I'm part of databrackets here, and as you could see here on the slide, the databrackets, we are primarily an assessment shop. We do data compliance, cybersecurity, regulatory compliance, and whatnot. So the primarily we provide two type of options for our customers. One is DIY, do-it-yourself type of platform where you can do your own assessments. If your environment is complex and you're handling much more complicated systems and whatnot, so we do have our consulting division who can come in and help you out with any of your compliance requirements and stuff. So the third portion of what we do is manage security, where like you need to do more of continuous monitoring and log monitoring, those sort of things. Definitely we can help you with managed security as well. As Aditi said, please feel free to reach out to us if you have any questions about any of the services that is listed here. So all of our consultants, they do have certification in one or many of the areas that is listed in here. And databrackets as such, like we are accredited by IAS, that is accreditation agency for providing ISO certifications and whatnots. And also we are certified by A2LA on ISO 17020, which is primarily our assessment methodologies. So that's a little bit about our company and our qualification, and these are like some of the services that we offer. Again, as you know, like HIPAA and HITECH is primarily, it's very much required in the healthcare space, and then for non-healthcare customers, we do offer other services as well. And some of our most popular services are like SOC 2 readiness and SOC 2 certifications, ISO 27001 certification and readiness, penetration testing and vulnerability assessment, and the NIST cybersecurity framework and 853, 171 type of assessments. So let's just dive right into our today's topic, which is HIPAA and telehealth. And so what we wanted to talk a little bit about today's meeting before we really get into the telehealth topic is like just a high-level overview of what HIPAA means and where the HIPAA regulations and other requirements kind of overlaps with the telehealth technologies and the requirements, telehealth implementation. Right. So primarily HIPAA consists of three main branches, right? First one is the privacy, which is the confidentiality of protected health information. So again, we might have a separate slide on the protected health information. Essentially, when you combine patient's name and other information, demography of the patient along with their medical condition, then it becomes protected health information. That's what the HIPAA is primarily concerned about. That is the scope of HIPAA. And whenever like you are dealing with a patient and any of their medical information and whatnot, that's when the HIPAA kicks in. So these are the three different sections within HIPAA. Privacy, which is as we discussed, is more about the confidentiality of the data in terms of like how you handle the data, how you handle patient's data, when do you share, and what purposes you use that data for, like whether marketing purposes and other type of things, and also like if the law enforcement requires that particular set of information, whether you share with them or not. A lot of those requirements are driven by the privacy rule. And the security rule is primarily when you convert that data, PHI, into electronic form, that's when the security rule kicks in. Whenever like you exchange data between two parties, HIPAA covered entities via electronic method, then the security rules kicks in. Again, like within security rule, there are three different requirements, which I will cover that in the next slide. And then the breach part is whenever you kind of, you're not able to follow the privacy or the security requirements, and you happen to have some kind of a breach, suspected breach, or like, confirmed breaches, then like you have the notification requirement, which was actually much more kind of, firmed up in the HITECH Act, which was actually introduced in 2010, 2011 timeframe. And so the breach notification specifically requires the entity, an organization, to notify if there is more than 500 or so patient data breach from the same state, to be within 60 days. Within 60 days from the date of discovery, an organization needs to notify the patients. So that's what primarily covered in the breach notification. So let's do a little bit deep dive in the security side of requirements, because that's what kind of kicks in when if you're considering telehealth, or if you are already if you have already operationalized telehealth and trying to tighten the securities and whatnot. So the security again consists of three main categories, like the physical safeguards. As you could imagine, it's all about how you are protecting the physical environment, like whether it is your data center or whether your office or a small computer room where like you have all the servers, on-prem servers and whatnot. That is all about the physical security, and also the end devices are also included in the physical security. Say, for example, you're accessing all the patient data using a laptop or a desktop, and whether you've protected the facility or the office using your physical safeguard. That's the physical safeguard requirement. And then the technical safeguard, as you could imagine, it's more around whether you have encrypted the data, whether you have enabled the logs, and whether you have set up the timeouts and whatnots for all the machines. And those are like the technical safeguards. The administrative is more along how you are managing the whole data, like whether you are backing it up, the data is available for patient care immediately, and like whether you're having business continuity programs, and all the other requirements with respect to the administration of the data. That's what comes in the administrative side of things, including your policies, procedures, training, and whatnots. Everything is covered as part of the administrative. I might be oversimplifying here. Actually, there are close to about 60 to 70 controls within these three areas, right? The physical, technical, and administrative safeguards. So we do have separate webinars where we talk about the specific requirements in each one of these categories, safeguards. And we do a deep dive in terms of what is really required if you want to comply with the HIPAA requirements and things. So if you are interested, please do let us know via chat panel. We will be happy to share the recording for that webinar as well. So these are like the primary requirements when it comes to HIPAA. So what we wanted to cover in this one is some of the violations that happened recently. Maybe it could be due to some stolen devices, whether the phone or the laptops, or like any of the removable media, they call it, like which stores the patient information has been lost. So that could be one sort of violation. And then there could be some security incidents, active hackers trying to get into your network and then siphon off the data. That way they can sell the data in the black market and dark web and make money off of it, right? So that's more about the attacks that are happening from professionals. And then it could also be due to any of your vendors or contractors who are doing business with you. You haven't you probably don't have a tight contract with them, and then if there is a breach from your vendor network, obviously your patients are affected, and then you are kind of responsible for letting your customers or your patients know that there was a data breach and the implication of it, right? So and then some of the other things could be accidentally one of your staff might be emailing or faxing some information to a wrong patient, and that kind of probably requires you to document that particular incident and make sure that affected parties are notified and things. So of course some of the other things that are listed here happens as well. Like we do have some incidents that are reported because the staff who's working in a practice has shared the information that they are not supposed to share with a third party. And then also these days accidentally people post the pictures and videos that could potentially involve patients and their informations and whatnots, right? So those are like some of the examples of violation. These are not the only violation types, right? So this kind of gives you in terms of what are like some of the things that you need to keep in mind as we are going through the HIPAA requirements for telehealth implementation things, right? So the key question is telehealth covered under HIPAA, right? So we have the actual terminology that's the definition of what is a healthcare provider and what is covered under HIPAA. So as you could see here, definitely telehealth is included as part, meaning if you are providing telehealth services, you're a covered entity, period, right? So a patient is using some sort of virtual platform to connect with a physician or a care provider, and then the physician electronically collecting information from the patient, and then that gets kind of recorded somewhere in their EHR system or like any sort of devices, and then definitely you're collecting this information, processing it, then you are becoming a covered entity. So telehealth is definitely covered under HIPAA if you're wondering whether it is covered or not, right? And then a few things that you need to keep in mind, with respect to HIPAA compliance when it comes to telehealth, right? So the first thing I would think is you definitely need to have some sort of policies and procedures implemented as part of implementing telehealth. So what exactly is the policies and procedures we are talking about? So the main thing is you need to have the notice of privacy practices that should be shared with your patients, right? So most of the places that if you're going in as a patient, then the provider's office, like in the provider's office, they will be giving you NPP, they call it notice of privacy practices, in terms of how a particular office will be handling the data, and under what circumstances you can request it, and what is your rights, patient's right, what is their right, like the provider's right, and what are the things that you could enforce as part of sharing your data with them. So that's number one, in my opinion. So you need to clean up your notice of privacy practices and make sure that you include all the telehealth services that you are introducing or like have implemented already, right? So that all needs to be covered as part of the notice of privacy practices. And also patient device security disclaimer is something that I wanted to bring up. So things happen. So if a patient connecting from a insecure system or device, then you need to make sure that you have a disclaimer in there that kind of clearly mention that you are not responsible for their system security and validating their system security before connecting to the telehealth platform, right? So that is something actually you wanted to make sure and notify them that you are responsible only for the platform that you are operating in and providing the telehealth services. And also there are other things, including the opt-in notifications. If, for example, not all of your patients will be interested in telehealth services, or not all of your patients will be interested in getting notification via email or via text and whatnot. So you need to make sure you get explicit opt-in consent from them, from your patients, and then they go through all your policies and procedure with regards to handling of data and things. Yeah, that is one. And then the next one, especially when it comes to telehealth, is recording. So if you see in a lot of telehealth practices, they would not by default record the session that is happening between a provider and the patient. So if you for any reason, if you want to have the recording, then you need to explicitly request that from the provider, and then they record it and share that with you. So those are some of the things that you need to keep in mind. Again, there are a lot of requirements when it comes to using a secure platform for sending out text and emails. Say, for example, if you are going to be sending a reminder to your patients about an upcoming telehealth session, then you want to make sure that whatever platforms you're operating in is all HIPAA compliant, and then you have reviewed and completed your due diligence of the vendors, so that your platform is kind of an approved, not exactly approved. There is no approval or non-approval of HIPAA compliant technologies anywhere, but it depends on the vendors' security practices and what is that they have published, what kind of the security best practices they have implemented. So you want to make sure that you have completed your due diligence of the vendor before you selecting a technology or a platform or sending out all the SMS and whatnot. The same thing applies for the email as well. So email, although like you might be using pretty standard Gmail workspace or a Microsoft 365. So we've seen in a lot of practices they use additional encryption technologies like Proofpoint and other type of encryption that kind of requires patients to provide additional level of authentication before accessing the email that is sent out by the provider. For example, patients might register for a two-factor authentication, and a unique code will be sent to their phone, and they use that code to access the email sent by the provider, or even access some of the technologies that we are talking about here, right? The telehealth and whatnot. So and then lastly, especially when it comes to telehealth, providers share a lot of images, videos also with the patient. So you want to make sure that you use secure technologies when it comes to sharing of images and other details with the patients, especially if you're sharing some large files and other things like X-rays and whatnot. So you want to make sure that you're using secure technologies and stuff. So there, of course, like with a pandemic, from 2020, there were some rules that were kind of, a little bit relaxed from HHS side. So what HHS clearly came out and said is, so they are not going to be enforcing specifically about the HIPAA requirements with the providers, or even with some of the other, the healthcare systems, if they are implementing telehealth technologies, because due to pandemic, like everybody was rushing to implement some kind of telehealth technologies, and they all know that, like, there is not enough time to do the due diligence, review, test, and then implement all of them. So HHS specifically called out and said, like, providers don't need to worry about, not having everything implemented as part of HIPAA. And then, so yeah, of course, discretion is, discretion is the word that they use, and say, like, the providers can use their own discretion to decide what kind of technologies and vendors they need to use. And of course, they do have a list of vendors that they recommend, which is published. Actually, the link is provided here in case if you are interested in looking at the announcements and also some of the products that HHS has provided on their website. But again, the key thing that you need to keep in mind as a provider is, in case if you are adding a one-off telehealth platform to your existing offerings, not via your EHR provider. If you're doing a one-off telehealth platform, obviously you want to keep that, you want to sign the BAA, which is a business associate agreement with your telehealth provider. So for example, if you want to sign up the HIPAA compliant package with Zoom as a separate pricing and package for providing telehealth. The same thing with Google Meet and Microsoft Teams as well. So you want to make sure that you have selected those packages before you kind of enable it for your practice. And also you need to make sure that you have that the BAA and other things signed with the telehealth provider. Right. So those are like some of the kind of the best practices that you need to keep in mind as you are, either considering telehealth or already have implemented and working on fine-tuning your telehealth programs and things. Right. So at this point, I'm really excited to introduce our telehealth expert like Jeet Chawla. And Jeet, as you could see here, like he has got like several years of experience in implementing EMR EHR systems, and he has a master's in healthcare administration. And he does a lot of work in the open EMR space, as some of you could relate. Open EMR is a big vendor. Like if you are not going with any of the proprietary platform like Athena Health and eClinicals or like Cerner type of thing, Open EMR is another option for a lot of the vendors, since it is the software technically is free. So there is a lot of interest in that space. So he's an expert in Open EMR as well, and he's been volunteering with OEMR. So yeah, if you want to learn more about Jeet, some of the reference links are provided. With that, it's my pleasure to introduce Jeet. Jeet, please.
Thank you, Srini, and it's my pleasure and privilege to be speaking here today on your platform. So thank you all for your time. I know your time is valuable, and hopefully this will be very helpful in terms of telehealth. I'm going to speak more on the practicality and a little bit of my journey. I think Srini did a great job of, talking about the privacy and security concerns surrounding telehealth. To start off though, my company is called Ace Health Solutions, and we're basically a consulting company. Like you mentioned, we do a lot of EMR work, Open EMR specifically as it's open source. I've also consulted on other EMRs before, like Practice Fusion in the past. I'm very knowledgeable of many of the proprietary systems, Epic, Cerner, but we've developed Open EMR and customized it, including the development of a telehealth platform. We deal with pretty much mostly clinics, have consulted on hospitals, but mostly independent multi-specialty clinics, a variety of specialties from primary care to cardiac to neurology to anything, pediatrics, a lot of mental health, and try to also talk about how we can work with your workflow and how it affects your revenue through the use of technology. As you mentioned, I've got a master's in healthcare administration. So check us out. Now let's go and talk about the need for telehealth. Telehealth is not a new concept. It's been out there for a while. As we started using computers and digital technology in order to record patient data. The next step was to see if we can conduct visits, but it really didn't pick up as much. I mean, the rural health problem has been there, and we thought about that, but the pandemic really brought home the idea that we could conduct a mass amount of medical visits through the technology. It wasn't just a benefit for a high-end EMR practice to use telehealth or a hospital, but it now became a way to cut down the risk of people infecting each other through COVID-19, just because of the, as you know, the variety of the spectrum of where people could be asymptomatic or have mild symptoms and still be infected. Of course, I talked about the rural health. Mental health is also an area that has been revolutionized by telehealth, and that's an area that has historically been underserved in almost every state in the country, everywhere, every jurisdiction. Mental health services are less than need be because of the large amount of mental health patients. And then, of course, people with physical limitations, transportation issues comes to mind, the diabetic who has walking problems, the elderly, the overweight, people who are bedbound for strokes, etc. And then it's another revenue stream for providers because, as you all know, if you've been in healthcare for any bit of time, it's gone from a procedural reimbursement system. You do more procedures, you get paid, to now a pay for performance with all of the measures that in the last decade have come out to NCQA and other organizations and insurance companies and government agencies have adopted that. So I think it's just now that we'll talk about later about some legislation that has been enacted to help even Medicare reimbursement for telehealth and other payers, private payers, of course, are paying for it. So this is really a good revenue stream, especially since now the procedural and the volume is not such a big payment model. I'm not going to go much into HIPAA compliance because, again, we hit that pretty well, but that is a concern, of course, right? So you are you are exchanging medical information, talking to the patient, having the patient talk to you through the internet. And of course, is somebody going to hack the data? This is sensitive data. How is my privacy going to be preserved? There are elements of physical examination that are done, not sensitive body parts, but areas like the head, nose. You can do it now through remote devices that transmit through telemedicine. So again, HIPAA is a big deal, particularly with this. And the second concern is, the fact that some people are just not very comfortable with computers. There's been a big backlash with a number of providers. I would say you could generalize fairly that it's usually the older providers, but it's generally, seen among just different types of providers now that don't want to even use a computer. Even EHRs that kind of don't like it. They want to go back to paper. Now this is at another level to that resistance. And then, of course, it takes, a lot of cost for vendors to build and make a HIPAA compliant manner the telehealth platforms and get it tested and all that, because HIPAA is really a serious thing to consider with penalties, and so they translate the cost to their users, and so third-party fees can get there. And then, like I just mentioned, that there's limited examinations, so sometimes the resolution or the ability for devices, let's just say that if you have a nurse or if you have somebody who is helping the patient with a otoscope or to look into the ear or something to look down the throat or auscultation device, some of these are more advanced, but that can be a little difficult, the sound or the visual part. A lot of times skin disease is very good for telehealth. I would say that's, something that many people use it for. I recommend that. But again, it's not as good as if it's face-to-face. You can't palpate, you can't touch, you can't look in very minute detail sometimes. So again, we need to consider those limitations with this technology. Nevertheless, there has been some legislation that has come during the pandemic to promote telehealth, just because we talked about that risk mitigation is very, very important, and the reimbursement has followed that as people have realized, payers have realized the value of telehealth. And the consolidated appropriations, what it does, extended the Medicare waivers, and it did other things too. But this waiver was something that was extended to providers to see patients, even if the geographic area, the zip codes, didn't really match, because Medicare had some rules around that. So they kind of allowed patients to be seen in various settings, in rural settings. They even had federally qualified health centers and rural health centers serve as remote sites. So there was a lot that was done with the Medicare response to pandemic, and the CAA kind of extended that for 151 days after the actual public health emergency period ended. And my second point, which I kind of touched on, is really, really important, that you could see Medicare patients virtually anywhere. I mean, the location of the patient, even their home, now qualified, which is typically what telemedicine has, is the patient's at home. But nevertheless, the codes, the updated fee schedule followed that, where a lot more, there was a lot more ICD-10 codes and CPT that were, reimbursable under Medicare rules. And as you know, Medicare, even though it's a government agency, a lot of private payers often follow or model Medicare, changes. Okay, so I know I talked before about some of the concerns of telemedicine, but And I'm going to talk about my solution and how kind of my journey is as we overcome that, because my ultimate position is proponent of telemedicine, but I want to provide the unbiased, sort of expose of telemedicine use. And the pandemic, of course, we're focusing a lot on that, but that's really important because we're sort of still in the pandemic, and that was a big boost towards telemedicine. So the positive part of this story, despite the concerns and any other restrictions it brings with telemedicine, is the fact that because of the risk mitigation and because of the increased access, now you can do quick telemedicine visits. There's no travel needed. You don't have room issues as much because now you're all virtual. This led to a market increase in televisits. Now, I know this is a 2020 CDC stat, and yes, the stats are lower now as we've gone back into face-to-face, but and we didn't expect it to last forever, but that's remarkable. And then another study out of Germany says that so many percentage of doctors, nurses, and medical professionals they surveyed, and the responses were that this really impacted us, and it made a big difference. And I believe that there will be a lot of positive parts of that as well, not just other impacts of concerns that we talked about. So the physicians felt in this survey that telehealth is easy to use. And yes, maybe some of these physicians were already sort of familiar with computers and EHRs, but telehealth technology has evolved quite a bit and it's been embedded in a lot of EMR solutions and integrated with EMR charts and stuff. So I believe that is part of it. And then also the improved satisfaction with work. I mean, physicians and providers could be seeing patients from their home. They're not having risk of COVID infection. They don't have to travel. There is just a sense that I could see more patients and I could, all kinds of things. Sometimes even a caregiver could be there accessible with the patient for history or whatever, because they're doing it from home. And then 68% of physicians reported they wanted to increase the use of telehealth in their practice. And this may have to do with convenience, but also the reimbursement, I believe, had a big part of it. Just another revenue stream. And it doesn't conflict with many of the other codes that are used in traditional practice. Because, payers oftentimes have rules. You can't use so many codes or, same day and together. This slide talks about, and again, driving home the point, and I'm not going to belabor on this, how telemedicine adoption on a very visual way is increased during the early part of the pandemic. As you know, it hit the US around March of 2020. And as you can see that there is definitely a decrease in the people who don't plan to use. So that resistance, the fear, maybe because it is a heightened health emergency, but still maybe more education, more exposure, the bigger use of Zoom and other technologies, even on regular Zoom, non-healthcare Zoom, made people more comfortable. And then you could also see the increase in people who have used it. And of course, that dipped down a little bit as people used it, and some people had concerns, which is the green line, but that's kind of expected with any technology solution. Okay, let me talk about our telemedicine solution. What we use is OpenEMR. It's an open source EMR, so the source code is available, and it's an SQL database, Maria database, and PHP and Apache web server. But I don't want to get very technical. You can do it on your own server. You can host in the cloud. I've done many AWS, and we have it on Azure and Google Cloud as well. And we get it very secure with all the cloud managed services as well. This is an Jitsi platform, so that's built onto the OpenEMR, which is also an open source telehealth platform, but it provides many of the key things that you want in telehealth. I mean, if you think about it practically from a clinical and operational standpoint, it's a visit, so you need to schedule it, so it integrates well with the calendar. It's like you can see here, you can't see maybe the name of the test patient, but you can see some of these icons, and there's like I'll just voice it for you in case you can. There's like a video recorder which starts the visit. There's a bell which is a reminder, because oftentimes get a visit scheduled a week at a time, and you'll send a reminder 3 days to the patient because they're not coming to the office, so they may forget. They're going on their home, they're busy. You don't want them to forget the visit. And this is something that can be sent SMS or to their email. And this is no link, it's just a reminder. And then there's also a link, and we talked about encrypted technologies. 365 Outlook can have encryption. You can do hush mail, proton mail. There are different things, but we also have for the EMR side a two-factor authentication, so which causes you to be authenticated before click on the link so the wrong person doesn't enter the visit. And then we have a waiting room, and so I know it's like, oh gosh, if I wanted a waiting room, I could go in live. Why do I need to sit virtually? But it's important because in this waiting room, as opposed to a real one, you can chat, and you can chat, and since it, this could go to like nurse, whatever, and they don't have to go anywhere. They could do multiple chats at the same time. That you can ask questions, and then you could this is on the patient. I'm sorry, the provider side, but on the patient side, when the patient logs in, they don't see the full calendar. They just see the little the little telehealth thing, which has start meeting and all that part, and they see the waiting room, but they actually have a counter, and they can actually see how long they've been waiting. So it's just excellent. The provider, what they do is once they schedule it and they're ready for the meeting, they'll hit start meeting, and then the next slide will show you, as me as your doctor example, on the provider side, this is the provider doing the meeting. Now I don't have any patients in all that, but you can imagine like on a Zoom call, you would have little tiles on the side with people's video, and so you can do the same things as you can do in Zoom or Teams or anything. You'll see down here, and again, it may be hard to see, but I'll just tell you that there's like a hand for raising your hand. There's a chat feature. There's a way for administrators or the person who's got admin access, like the provider, to mute people. You can actually do even additional things like a whiteboard. Let me talk on this slide a little bit here. We have the whiteboard that you can draw on, and that's very important for medical visits. Sometimes when you're doing education, like diabetics, or you're pointing something out, you can also play a video. And we also have an ability to record it with the patient's permission. Again, the opt-in, opt-out, those policies and procedures are very important. So when you have patients sign form and consent to HIPAA forms and notice of privacy practices, include your telehealth, telemedicine forms, and include there all the details. Could we record you? The recording would be if we were doing some kind of educational thing. Most of the times you probably won't record. And then, of course, easy meeting setups. You get the link and you get the SMS. We have a way in our solution to even get a third person, like a caregiver, in if you're dealing with people who are disabled or elderly. And we did this first for a mental health clinic, and we had a lot of people in substance abuse. And even though they were relatively young people, they needed somebody there, a caregiver, to help talk to the provider. And then the rest of the stuff I've mentioned previously. We're almost done here. The services that I offer with Ace Health Solutions is that we offer our customized version of Open EMR. Now it's open source, you can download it, but the telemedicine platform that we have created with the customizations is on our customized version. But I also offer, since you can download the software on your own server, a way to do telemedicine development implementation where we can either affix it to your Open EMR instance, or we can work with, the second point is that we can work with another EMR system that has an open API. The API application program interface means just basically, in layman's term, a way, code way, programming way to connect to the telemedicine. Some systems are closed and they don't allow that. And we can attach the Jitsi to that. So we can, we can do any three ways. We can give you a customized solution. We can take it and attach it to your EMR system, or we can just provide developers and engineers and architects to work, as long as there are no contractual, legal, or otherwise technical barriers towards connecting to your electronic medical record. So I think that that's it for me. I just wanted to talk about, telemedicine from the implementation practical point of view, as well as it's kind of what we've done. And I think that this is something that you're going to find with almost every EMR vendor now, that either they have one or they're thinking about one. And I think it's not going to go away. The pandemic will peter down. We're still in it, but the rural health, the mental health, the patients that can't come to the office, that will continue to stay. So I think it's very important to think about it. The HIPAA concerns, Shiri talked about it well. We actually have, like Amazon Web Services, now their providers, they have a BAA they're going to sign. We have encryption at rest and encryption at transit. We have offsite backups, disaster recovery. We have HIPAA compliant platforms. And like I said, with the login, multi-factor authentication, all kinds of opt-out. You can't force somebody to do a video, even though you can mute them. So there's a lot of things that would be implicated when patients are concerned, rightfully so, as well as providers, in making sure we respect people the way they need to be respected, yet providing care in a way that is convenient and very reimbursable in today's market. Thank you very much for the opportunity, and I think Shirley will now take over again.
Thanks, Chip. If you don't mind, just stay with us. I think we might have a few questions and things. Yep. Okay. Yeah, looks like thank you for submitting your questions during your registration. Looks like we have a few questions that are already submitted. So the first one is, will telemedicine, telehealth rules in the US change post-pandemic? I think this is more along the compliance, like the HIPAA compliance side of rules, I guess. The question is more about that. So, so the short answer is we don't know. And we are expecting that obviously, the HIPAA rules are not going to be implemented differently, across different industries. It's going to be pretty much consistent, right? So, but I think like we are expecting it in the next probably a year or so. The rules probably will go back to how it was in a pre-pandemic stage. So that means, all of the HIPAA requirements are going to be applicable for the telehealth providers, like the care providers, as well as, the product vendors. Yeah.
And I could just add to that, in speaking towards, like, again, I'm not an expert in the legal area, but based on my reading, it seems like the Medicare waivers that were implemented and other corollary type of similar type of regulations that were laxed during this period. I mean, audits were less. Typically under the CARES Act, you needed to have a relationship, an existing relationship with the patient in order to have a Medicaid waiver. But then the Consolidated Budget Act extended what was going on, which was basically less audits to enforce that. So I think that what it is that the Medicare rules, the payer rules, I think she was right that the rules will probably, some of them will go away, they'll be retired. But I still think there's some time. I think that with extensions and stuff, there will be some kind of platform for people to continue to conduct telehealth in a way where they can see a lot of patients and they'll be able to bill regularly for it. So we'll just have to see in the 2-3 years what the situation, reassess.
Thanks, Jay. Then the next question is, what are the key security and compliance considerations for implementing telehealth solutions? I think like we kind of covered that already as part of our, slide, I guess. Like the most important part, I think, is first, if you are implementing any new telehealth, first of all, you need to figure out whether it is in-house or, out of the box that you are purchasing from a vendor. So if it is in-house, obviously it has to go through very comprehensive security assessments, and then like all of the issues that are identified needs to be remediated and whatnots. And if it is out of the box, then your responsibility will be to make sure you complete your due diligence of the vendor who's providing this telehealth service, and also to make sure that like you have the BAA contract, the business associate agreement, signed with the telehealth provider since all of this patient data, whether it is the video form or like whether it is text and whatnot, and the images, everything goes through their platform. So obviously, you need to have the BAA with them. So that will be our kind of recommendations with respect to the security and compliance. Of course, from the implementation side of things, I think Jeet also talked about some of the opt-in, the forms, policies from the patients, and the notice of privacy policies that needs to be shared with the patients. And you need to tighten up the processes that you have with the patients to make sure that you have all of them either acknowledged by them, or whoever is part of your telehealth service provider are all well trained with the new technologies and whatnot. Jeet, you want to add anything on top of it?
No, I just think that, again, just to respect the fact that the patients, when they receive their links, either through email or text, that, it's secure. And the fact that when we're in a telehealth visit, there's a process for letting patients into the room, making sure that the right patients, and make sure that, we can't force video and all those kind of things, because there could be some sensitive either examination or discussion. And then, of course, the procedures around the recording. You talked about opt-out, but specifically, I would include in your policies any type of recording, because that is a concern. So those would be compliance things that can have legal implications if they're not followed.
Thank you, Jeet. Jeet, probably this question is more for you. What are some of the key clinical and operational benefits for adopting telehealth solutions? Yep.
Well, I don't want to sound like a broken record, but once again, I think the key clinical benefits could be to be able to address, examine patients without exposing risk for an infectious virus, or it could be other things as well. Right? There could be some other infection the patient has, which is either airborne, that it's always a risk. And if you wear a mask, there's still a risk in face-to-face. I think another clinical benefit could be to basically have patients who are examined in their own home setting, and sometimes the visit is easier and more valuable. Patients come to the office. Certain patients may not feel comfortable, or they're doing blood pressure. Their blood pressure may be high, and so I think if we can pull it off on a remote visit, if it's clinically appropriate, it'd be good. I think operational, though, clearly is just being able to keep the traffic down in the clinic. It's another revenue stream, and I think it's something that is in line with the wave of the future, what we're going to do using technology, especially since almost everybody is on electronic health records these days.
Thanks, Jeet. With that, Aditi, back to you, please.
Thank you, Srini. We'd like to thank everyone for their time. Feel free to connect with us by phone, email, and stay connected with us on social media. We look forward to connecting with you on our next webinar. Thank you and have a wonderful day.
Thank you.
Thank you.
For more information, click on the link below or visit databrackets.com.